Sachin, I want to ask you a question.
Just one.
How are you so good in live clinic?
Okay.
Because yesterday it was a blast, a demo.
So do you need a serious answer or
I
you
need a
fun
serious answer.
So a serious answer is the way we've been taught. And I think, if I go back to my old college days where I was in training, a lot of emphasis was on clinical examination because coming from India, we were not a very developed society then, and we did not have good access to fantastic MRI scans or CT scans or even X-rays for that matter. So the real clinical skill, the art of diagnosis, was extremely important, and which is where I think I've learned to sort of dwell deeper into trying to understand how do I come to a good clinical diagnosis by taking a good history, trying to understand the problems of the patient, and also by doing a fairly decent clinical exam, which probably brings us to what would be the clinical diagnosis. And of course we now have excellent imaging to support our whole thought process.
It's amazing because I think in a young generation, they look at the MRI first.
That is something that I absolutely hate. All my fellows, when they come for any clinic, when I'm training them, I absolutely hate it when the first thing when the patient comes and sits in front of them, they'll reach for the docket of the MRI scan, they'll put up the MRI scans and start seeing them. And they will get wrapped on their knuckles, they have to keep away all the images, they have to listen to the patient, do a clinical exam, and then only does the imaging come up.
So do you think that it's one of the reasons why you create Pune Course Congress, which is after PCO the best congress in the world?
Okay.
Because you want to show people that, because in your congress for years, we do clinical exam on the real patient, then we operate them in front of everybody. And you really, I think you're always focused on that because I think from the beginning to the end, your quest was like clinical exam is 0.0, and then your training way of thinking is around that.
Okay, thanks Matthieu for that. But I think what's really important is that we're not trying to treat images, we're trying to treat a patient. And if I'm trying to treat a patient, I need to know what's happening to them, and we need to understand the various laxity patterns. I mean, okay, if you give me an image of of a laximeter and you show me that there's like a 6 millimeter translation of the ACL, but we've not compared it to the opposite side, and we need to understand the laxity patterns, whether it's hyperlaxity, and all of these are very important aspects when you're trying to ensure that you're giving the perfect surgical treatment for your patient.
Okay.
Yeah.
Anything else to say about the Congress, the venue and everything?
Anything else? A lot to say about the PCO. I really like the PCO because I feel it's something which is very close to the philosophy that we have back home in the Pune Knee Congress. I like the way we have relevant discussions. The topics are absolutely relevant, which is really important. There's a lot of focus on surgical technique, on surgical indications. Yes, we need the statistics, we need the free papers, we need the cadaveric studies, but I think the real focus is that we want to treat real life situations, real life drama that we see in our clinic, which is why the word practical course is perfectly embedded in the philosophy. It is a very practical day-to-day aspect that all of us need to focus in our clinical practice. So my message is that if you've not attended this meeting, I think you're missing out on something. So make sure that you're there next year for the PCO.